Oh, welcome back to my channel. This is your friend No Solution. This is a page you can get your health tips. Let's talk about the times a pregnant woman should avoid sex. During pregnancy, it is essential to consider certain factors before engaging in sexual activities. So let's dive into some situations when a woman should avoid or approach with caution when having sex. Number one, medical conditions like placenta previa. This is a condition where the placenta covers the whole cervix, increasing the risk of bleeding. At times, it might be due to cervical insufficiency. This is a condition where the cervix is weak and may open prematurely, leading to miscarriage. It might be preeclampsia. This is a condition characterized by high blood pressure and damage to organs. At times, it might be multiple pregnancy. Carrying twin, triplet, or more increases the complications of pregnancy. Pregnancy-related complications is very common. Then, of course, we have pregnancy-related complications like vaginal bleeding. Any bleeding during pregnancy is a concern and requires urgent medical attention. It might be premature labor. If a woman is at risk of going into labor prematurely, you should avoid sex. It might be ruptured membrane if the water breaks prematurely. Then what are the other points to consider? History of miscarriage. Women with history of a miscarriage may want to avoid sex during early pregnancy. History of premature or preterm labor. Women with history of preterm labor may want to avoid sex, especially during the third trimester. Then, of course, amniotic fluid issues. Women with low amniotic fluid, that's the fluid that surrounds the baby, levels, may want to avoid sex to prevent further complications, so both to the baby and to the mother. So, general precautions: avoid deep penetrative sex to minimize the risk of discomfort or complications. Avoid sex if you are experiencing discomfort during sex. If sex is uncomfortable or painful, it is best to avoid it. Then you should use proper hygiene, practice good hygiene to minimize the risk of infection. It is essential for pregnant women to discuss their individual situation and any concern with their healthcare provider. They can provide personalized guidance and, of course, recommendation. So see you in the next video.